Good morning, good afternoon, everyone. Welcome to the webinar titled The Science of AMR in the Independent Panel on Evidence for Action Against AMR or IPEA. So just some house rules before we start. This webinar will be recorded and we will have a moderated question and answer portion after the presentation. So please feel free to ask questions through the Q&A function. And do take note that a recording of the session will be available on HiTap's official YouTube channel. I am Sheila Marie Salisana from HiTap Thailand. So we want to hear from you. So if you can, kindly answer the Zoom poll. So we're still waiting for 5 more answers, 3 more. So we want to learn more about our audience. So from this, I guess almost like 85% are working on human health. And it's good to know that we have people from the animal health and environmental health sector, which I think is kind of underrepresented in terms of AMR research. Now, how familiar are you with the Independent Panel on Evidence for Action Against AMR? It's good to know that half of you had heard the name, at least heard the name, but don't know what it is. So this webinar is very timely. We'll definitely learn more about IPEA. Next. So the objective of this webinar is basically to discuss a scientific work plan of IPEA. So this includes presenting the foundation document, outline potential structures for future priority setting, work plans, and outputs, and how external organizations like your organization can influence the panel's work. So this will be the agenda for today. We will have a 30-minute presentation from Mike. So we have a very distinguished speaker for today. This is followed by a moderated question and answer for 20 minutes, and then summary and closing. So without further ado, let me introduce to you our distinguished speaker, Mike. So he is a globally recognized leader in AMR. He's a professor of pediatric infectious diseases at St. George's University of London, where he leads the Antibiotic Policy Research Group, a WHO collaborating center for antimicrobial policy and stewardship. Mike has served as a senior advisor to the WHO for many years, including as a member of the expert committee on the selection and use of essential medicines. He chaired the antibiotic working group of the WHO essential medicine list, and he developed the access. He was one of those who developed the AWARE or the Access Watch Reserve classification for antibiotics, as well as the WHO AWARE book. He also leads the Wellcome Trust-funded ADILA project, which stands for Antibiotic Data to Inform Local Action, which aims to develop novel risk-adjusted models for optimal aware antibiotic use globally. Mike also chaired the United Kingdom Department of Health's National Expert Advisory Committee on Antimicrobial Prescribing, Resistance, and Healthcare-Associated Infection. He is currently the lead clinical advisor for neonatal and pediatric program of GARDP, or the Global Antibiotic Research and Development Partnership, and serves as vice chair for AMR for the Penta Foundation, which is a global pediatric infectious disease research network. Mike leads multiple international projects aimed at improving antimicrobial stewardship and combating antimicrobial resistance worldwide. So we are very honored to have Mike today. So over to you, Mike.
And thank you very much indeed, Sheila, and thank you very much indeed for asking me to our next slide, please. Thank you. And so what we're going to do today is to talk a bit about this independent panel on the evidence for action against AMR. And that is a little bit like the independent panel for climate change. It'll be the scientific committee for antimicrobial resistance. And there's been a lot of discussion about how the panel should be set up and how the panel should be organized. And what we're going to do today is to talk a little bit about the scientific structure of the panel, how it might look, how it might be sort of taken forward, and how the work of the panel sort of needs many different people to become more involved in it as it moves forward. As discussed with Sheila, that I'm talking a little bit today, also as the international officer for AMR for the European Society of Clinical Microbiology and Infectious Diseases, ESCMID, and some of the work that I present today was conducted sort of through ESCMID. Thank you much. Next slide, please. So there's been, and you can just click through these, if that's very kind, Ryan. So there's been a number of documents that have been led to the development of the AMR over the course of the last number of years. And it's been lurking around for quite a long while. Next slide, please, Ryan. And it's been a discussion about how we try and sort of set it up since nearly 20 years. And now finally it looks like it's happening. And at the 79th United Nations General Assembly on Antimicrobial Resistance in 2024 in New York, the countries finally adopted the political declaration which invited the quadripartite to facilitate an IPEA. The quadripartite, when it discusses that, is actually the 4 UN agencies that are very much involved in antimicrobial resistance, obviously, as she was talking about, which of course is WHO, and then the World Organization for Animal Health, the Food and Agriculture Organization, and the United Nations Environment Agency. So that's environment and sort of food and agribusiness, and also then animal health and human health. So this aims to facilitate and have multi-sectoral evidence. And the idea of the panel really is try and support member states to tackle AMR and make use of existing resources. The panel doesn't have much money, as we'll discuss as we go along, but it is designed to try and have outputs that we'll talk about that actually member states hopefully will find helpful and will actually try and improve the implementation of policies to try and tackle AMR. So like all of the organizations, you have to have what are you doing? So there's a founding document, a draft 0 was published August in 2025. And more recently, there was another document about how the panel should be organized. And actually, these have to be agreed by the member states. Member states we're talking about here are governments, sort of kind of the global governments. And the documents that have been published so far about the independent panel are very different. And this is all about the governance. Next slide, please, Ryan. So and fundamentally, the sort of kind of the structure, the political structure of an independent panel is important because that influences the way in which governments work with a panel and how much influence the panel would have in the deliberations and policies it governments. So
Mike, apologies, we cannot hear you. The volume was just went off.
Okay, can you hear me now?
Yes, great.
Okay, go back to that. All right, so the internet's a bit unstable, that's fine. So that's if I'll just switch internet. Is that better now? You back with us? Yeah. Okay. Okay, keep going. So that's sorry. So and actually that was a very complicated structure, but it had a lot of government engagement with that. The next draft of the document about how we're going to set up the panel changed completely. And then it became really about an expert committee. The first draft had 6 scientists globally to cover all of those different areas. That's quite hard. And the second draft had about 30 scientists, but actually very limited role for governments. And we're now waiting for a new draft. The details aren't important, but actually what's the principle you're trying to get over is that the role of the government in how these independent panels set up and how they're run is actually critical to their function. Okay, next slide, thanks. So the structure is that the science, when we're talking about science of these independent panels, what we're talking about is the analysis and synthesis. So this is really evidence synthesis. They're not going to conduct independent research. They're not going to do a sort of any basic science, and they're not going to do any of the sort of fundamental underpinning. And they're actually all about analyzing and synthesizing other work that's been done in the area. So this obviously has to be politically and commercially independent, but also member states need to see the practical relevance of the panel. If it's not useful, it won't be used. And so currently, the executive committee, which is the sort of which is the scientist part of is the decision-making body of the panel, and the key part of this is how do you decide what you're going to do, because AMR is huge and it's vast, and there's no way that you're going to be able to get to cover all aspects of AMR within a sort of in a panel. And the first panel obviously will try and probably run for around about 4 to 5 years or so, and it may, like other independent panels, actually then continue after that and get to a sort of other parts of the work plan in subsequent sort of years. But actually, what you do first, and is going to be quite obviously quite a strong discussion about which bits you tackle first. And the implementation of the work of the panel is usually done by the independent working sort of ad hoc working groups. So like any other structure, there is going to be other people who will go off and try and do the evidence synthesis, systematic reviews. We're talking about really sort of short reviews of different topic areas. And of course, those people are going to be critical because they're the people who do the work. Otherwise, the panel just tends to sit. But the person who goes off and do all the reviews are actually going to be sort of have to be commissioned to do those as well. And lots of people hopefully will get involved within that. Next slide, please. So what should the IPEA do? It should produce policy relevant recommendations. So the idea is you integrate the evidence all across the One Health sectors, and that supports real-time knowledge translation. So that allows policymakers and produces a very short summary. AMR is so complex. Thousands of papers are published, sort of many thousands every year, of course, and across all the different sectors. And people tend to stick to their sectors. On the whole, human health, people read the human health literature, animal health, the animal health literature. And so it's quite hard to keep up with all of the different areas. In fact, it's impossible to keep up with all the different areas. So this reduces the duplication of efforts and also will help to try and focus investment in research. And then the second thing really is the panel should promote policy uptake and implementation. The idea of these things that you produce them and then they just sort of sit is pretty useless. And actually the idea is that they have implementation tools, short summaries that facilitate the prioritization of these context specific and cost-effective interventions. One of the aspects of this, of course, is that, for independent panel for climate change, there are mechanisms, ministerial meetings, government meetings, and other meetings that will run along in parallel to the independent panel that will sort of try and allow this sort of prioritization of some of the outputs of the panel for governments. And you can see that with climate change, that actually the independent panel has been extremely influential in trying to push forward some of the scientific evidence, and also some of the policy actions, albeit, of course, governments will then implement those policy actions or not, dependent on government priorities. Next slide, thanks. So what should the IPEA do? Thanks, Ryan, put all those up. So I think some of the fundamental tenets sort of when you're setting this up is that, the panel must ensure that low and middle income countries' perspectives are represented and that the recommendations are really cost effective and sensitive to the sort of kind of the unique social institutional context that drive AMR in low and middle income countries. If that's where the burden is, if the burden of AMR is in LMICs, then actually then there really has to be recommendations that understand that context and understand the parameters and complexities of sort of potential policy interventions. The other ideal for the IPEA is that it actually starts to unite the One Health AMR community. It is, on the whole, still slightly fragmented. on the whole, there have been, so there's conferences, meetings, science meetings, really are very much around sort of sectorial specific. And ideally, the IPEA will act as a way of trying to unite the One Health AMR community, and particularly, also reach the high-level decision makers, but also make the case for investment in AMR. There's clearly a very major global threat. And now we're very well aware of the funding constraints internationally. And I think part of the panel's sort of role is to raise the priority and try and sort of make that case for further investment in the science and policy interventions. And also we need to facilitate, the panel would need to facilitate tracking of global progress, or indeed, the lack of any progress on mitigating AMR and building on the recent global AMR targets that were discussed at UNGA, like the 10% mortality reduction or the 70% aware access targets, to try and create some soft accountability and governance. And there have been a number of in other independent panel areas, there have been a number of dashboards or other types of tools that have been developed, so progress can be monitored more actively within that. Next slide, thanks. And before we get into the details, the other component of this really is that this all should be public health focused. So this is really framing AMR as a public health problem. And that's, emphasizing prevention, population level, more surveillance, health promotion interventions and solutions, optimizing the use of medicines that actually are the public health need, and then trying to focusing AMR very much as this sort of public health concern. And therefore, this is about prioritizing sort of interventions that demonstrably promote public health benefits, as well as benefits for the animal and environmental sort of health as well. So, the recognition of AMR as a biosphere, as a complex biosphere issue, I think is critical to the role of the IPA. And therefore, you need to integrate multiple clinical sciences, biological sciences, behavioral and social sciences, to try and sort of think through what the barriers are and take these sort of interdisciplinary approach. Thanks. Next one. So, like a lot of other independent panels, this is really about equity and access. So there is an uneven access now to existing antimicrobial drugs. There's access problems to effective antimicrobials, access to a lot of very, of the important generic antibiotics that are critical to providing sort of public health focused treatment, and also access to new drugs and other treatments as well. So I think there's a need to document the inequitable impacts of AMR globally and trying to priority this within an equity framework. There's a need to improve human and animal health systems and data quality, because a large part of this is data. And increasingly, of course, as we move ever more into a data age, then there will be a large amount of data coming into the different organizations, the quadripartite organizations, GLASS and Animuse and Infarm and many other sort of surveillance programs. And there's to be thinking about how you can use these data, try and measure progress, and using a lot of metrics from public health, including reduction in infection burden, antibiotic overuse, and sort of other inequities. So I think, one of the other components that we can see in independent panels is that this becomes a very data heavy and a very large data heavy sort of, process. And that can become daunting. It can become quite complicated. But one can see that actually that is a sort of inevitable, really, when we're dealing with such a large and complex position. Next slide, please. So just to get onto the sort of kind of the meat of what we're discussing today. So, how should this science, be structured, and so on the whole, structure influence outcomes. We know that. And so, what are the optimal methods? Trying to find and answer the key questions. What are the key questions, that actually the panel should be tackling? And then, what is the sort of quality, relevance, and usability of output? So now we'll move on to the sort of actually the details of what those might be. And next slide. Ryan, thank you. And also, who's going to be involved within this? So there are a lot of people working in AMR. This is by no means an absolute list, but you start to just look around at all the people who may wish to become involved across the quadripartite expert areas. And there are so many different groups, from basic scientists, drug discovery scientists, social behavioral scientists. I'm not going to list them all, but you can see This is by no means a comprehensive list, but how to try and integrate all of these different groups, how to try and provide some sort of representation in this way, but at least make sure their voice is heard, is going to be a very complex issue. Next slide. So how might it be organized? Well, usually people always look to see what other groups, similar groups have been organized. And this, the organization and structure of the independent panel for AMR is going to be run by the United Nations Environment Agency and who actually run the independent panel for climate change. Generally, in my experience, people use the basic framework for certain organizations and then think about how that would can be adapted. So the Intergovernmental Panel on Climate Change has three main working groups. Working group one looks at all the climate change, the trends and risks. So what is climate change? What are the trends in climate change and what are the risks associated with that? And by risk we mean sort of what is the sort of a trend about for the future and how those what is the sort of the science around those trends and how robust are those analysis of future trends. Working group two, their second working group is the impact. What are the impact of climate change across multiple different sectors, of course. And then working group three is the intervention. So, what is the interventions for mitigation or adaptation? And so those are the sort of, three groups, and then the outputs are synthesis reports, special reports, methodology reports, and we can talk about those as well. So the there are a range of other panels, and many of some of the documents. The South Centre have also produced excellent sort of summaries, and there's also other organisations and structures have produced some sort of excellent summaries around the different sort of other panels to work out how the IPEA should be organized. And actually, for example, IPBES, which is the panel on sort of biodiversity and ecosystem services, has a very interesting with a much more regional and sub-regionalist assessments, and will include a lot of non-scientific knowledge, within the sort of kind of the structure. So some panels have a very much a hard science, others have a much more wider, diverse sort of inputs, and much of that sort of kind of also exchanges and alters over time as well. Next slide, please. So in the end, an independent panel is going to have to define a work plan, and then obviously we'll have key science questions because that's the nature of which these that have kind of organized them. We'll walk through the science questions in a minute and sort of think through what those might be. But this is the sort of kind of type of work plan. And if you like a copy paste from the independent panel for climate change, it would look something like this. As well. And so, what would be, the trends and drivers and risk of AMR and AMU. And I think within this, I mean, and probably as in other independent panels, the climate, and others, the climate change will notice that antimicrobial resistance and antimicrobial use are clearly integrated. But as in GLASS, for example, and in the other organizations, the surveillance programs for antimicrobial use and surveillance for antimicrobial resistance, microbiology data, and sort of and medicines use data are slightly different structured. So, what are the most scientific relevant patterns across all the quadripartite sectors? What's the different biological mechanisms, that are driving AMR, and then trying to think what the sort of past and future trends would be. A second, panel, a second sort of work stream, if you like, would then look at the impact. By this, we're talking about sort of health and economic impacts and all those other components. And then work stream three is looking at the interventions. So what are the prevention interventions, IPC, vaccines, husbandry, hygiene and wash, for example, and the treatment, interventions, antimicrobial policy, novel therapeutics, diagnostics, sort of, and stewardship and other strategies. And a lot of that is about sort of assessing the cost effectiveness and impact of different interventions, both at the national levels and the global levels, and thinking about what these robust measures might be to strengthen these. So let's just walk through these quickly with a little bit more detail. Okay, so work stream one is, we'll look at the key patterns and trends of that. I think, and I won't sort of walk through all the slides, but it's really about the biological and ecological mechanisms which drive AMR. And particularly, I think it's around the spread and within and between section. In a way, where does AMR stay within a sector, within sort of, agri-food or animal health, and where does that sort of spill over into human health? Where does human health sort of spill over into the other sectors? And that's going to be really important to try and understand. And how is that different in different settings? From low income, sort of middle income, high income countries. And I think there needs to be a much more understanding of the structural, social, and behavioral and health system factors that actually influence these AMR dynamics. And then trying to work out what is the relationship between antimicrobial resistance and use. As antimicrobial use goes up, and actually also as we have major demographic change, particularly the rise in the elderly population, and particularly in Asia, what are these global demographic changes, and how does climate change and other influence these sort of future trends? Next slide, please. So your question might be something like, what are the dominant transmission pathways and the biological mechanisms that drive these cross-sectoral spreads across the different compartments? What are the key patterns of AMR and AMU that actually are relevant to all the quadripartites' health, and what is their past and likely future trends? One of the problems of things like the independent panel is that the lens is quite long. If a panel goes away for 5 years and sort of kind of burrows out, then produces a report at the end of 5 years, you then enter a sort of kind of a time warp where everybody's kind of forgotten about the panel, what's it doing, what's going on, so are they still there? Good Lord. And it's sort of kind of, and that's obviously a bit of a problem. So, it may well be that the panel will need to think about doing some rapid assessment reports in the first year or two very quickly to try and sort of do some rapid data synthesis, for example, on antimatter manufacture and use across all the quadripartite sectors, and then sort of think about some optimal current and future levels of use. So, I think there is some things that need to be moved on with fairly quickly. And also there's a way of trying to sequence these different work streams. Next slide, please. So, what are the public health and economic impacts? This is obviously really public health, and that means that it has very much sort of a similar, and it has, quite a way, a lot about has a very HTA approach to trying to think about the public health impacts. Also to look about the distributional equity effects, and particularly around the socio-economic outcomes, productivity losses, healthcare costs, impact on national income. So very much across all economic outcomes, sort of kind of particular writing right up to the macro impacts on employment and trade, for example. So, and particularly thinking about the public health benefits and the costs and effects of unnecessary or inappropriate antimicrobial use across the sectors as well. Next slide. And then, what might be the impact of AMR? So, that's fine. So what are we talking about here? What are the national and global health impacts, around this? And particularly the external global drivers, that we're discussing here. And then the next slide. And then, we're now thinking about sort of, and then what is the policies? So then trying to work through what the policy and governments would be. So, there are so many different potential AMR policy interventions, and they're so diverse, and they interact with so many different ministerial departments and sort of so many government departments. It becomes quite complicated to put this together into an overall unified problems, and that's what many sort of kind of national action plans have struggled with. And I think there's now really thinking much more about the cost effectiveness of these different policy interventions, their contextual feasibility and their potential sort of impact, and doing this with a sort of improving access and rational use, and sort of focus on equity, I think is a key way forward. Next slide, thanks. So, a lot of this will be about sort of synthesizing the evidence, for infection implementation strategies. One of the problems with this is that there is very little evidence for effective implementation strategies so far. So there's been a number of policies that have been developed, but actually not a lot of papers out there or reviews or policy documents that are actually showing this is what we did, this is how we derived a policy, this is what we implemented, and then this is what the outcome is. And so the literature in this is very limited, and I think that's a problem. And that's partly because we've only had major targets, if you like, from the UN General Assembly for the last few years or so, and so there hasn't been a long history. And panel for climate change has been going for nearly 50 years. So one has to recognize that there's a long sweep of this. But I think there is a part about looking at potential regulatory frameworks and financing mechanisms that, hinder or broad this public health. And then, really importantly, to now start to develop these robust monitoring and accountability methods. So, across the quadripartite, then it's trying to develop not only WHO, and all the quadripartite to developing GISA as a global surveillance platform, but also are there external groups and actors that can come in and start to think about trying to develop, a monitoring and dashboard, and so trying to understand and begin to hold governments to account about, well, these are the policies and, what are you doing, as has been happening in many different other areas. Next slide, thanks. And so, the questions really, is thinking about, what is the relative impact around all these different strategies, and then, and also how can the strength of the evidence and the level of confidence in the interventions be assessed. So there's a whole lot of there's a science around this, of course, is to, governments want to only act when this evidence is really strong. We need to do something. And the weaker the science, the more easy it is for everybody to not do anything and not do any sort of action. And so that needs to be one of the bits where, there is really strong evidence, then that needs to be communicated. And when there's less evidence, that needs to lead into further research. Next slide. So just kind of working our way through to the end here, and sort of kind of thinking about, what are the sort of outputs that one would expect out of this. So the independent panel for climate change, it's just the sort of it's been going the longest is and produces assessment reports. And in your spare time, if you wanted a bit of light reading, then please do go back to the independent climate change first assessment report. It's actually very interesting. And it's interesting, I think, if you go back to the first assessment report, sort of kind of, many decades ago, then, that shows that actually the science is pretty robust. And, what's happened over that time is that they managed to communicate very well what the science would be, and then, build and steadily build the evidence behind that over time. There's policies, as always, policy technical briefs. There potentially would be some horizon scanning, if there's a new threat that might require prompt attention. And there's a lot about this knowledge management, about the evidence synthesis, and what are the recommendations for future surveillance and research. What do you need? What can you do now? What should you do now? And then what actually you need more researchers, and a value of information approach, to this is probably sort of one of the ways forward. And we need sort of to define and look at sort of trying to think through what the sort of models and the problems are that underpin this relationship between antimicrobial use, for example, and resistance. What are all the potential interventions around that? And then what is the way in which you can produce sort of summaries and outputs associated with that? And organizations like ITAP have a sort of role for trying to sort of think through how those outputs can be communicated and can inform policymakers, as you would with, for example, sort of kind of HTA type structures and organization. There's clearly going to be an information sharing, and that's fine, capacity and as well. Okay, so this is, as you can see, a lot of work. And just to be clear, this is voluntary work. So this is not paid work, guys. This is voluntary work. The independent panel does not pay the people who are on their panel. The independent panel does not pay a lot of the scientists. Hundreds and hundreds of scientists provide input to the independent panel for climate change. And they do that in their own time because they believe in the overall process. So and that's a struggle. And one of the problems and the struggle that we will have here, of course, is there are just not as many people doing AMR work in many areas of AMR. It's a lot thinner than some of the other areas. And so, we have got a smaller pool of people to tap on. They're pretty busy. And I think we also have to reflect that actually, this is complex and very difficult sort of kind of, analysis and synthesis as well. And so that's going to be a problem. So the next slide as well. So what to discuss? I mean, I think how will, scientists, how can everybody across the quadripartite, animal health and all the different sectors and environment sectors put input into defining the key questions. This is the priority setting. What are you going to do? You can't do everything. It's only a few years. How is the organization membership and the work plans? Are all these going to be fostered, particularly sort of ad hoc working groups? And, can academic groups, can take those on? How can we engage these leading global scientists in challenging times? At the moment, there's a real problem. There's a shortage of funding in the area, shortage of funding in all scientific areas. And, people need to focus on all other aspects of their lungs. And what are the realistic of overlap of the work plans? What can be done in parallel? What should be done sequential? And particularly around the design, conduct, and the funding of this technical analysis, evidence synthesis. This takes time, actually, really decent systematic reviews and takes time. It's not easy stuff. It takes a lot of people time. They're very complicated and quite difficult to do really well. And, you're going to have immense pressure on getting these things done quickly. So there's absolutely no doubt that IPEA will need you and will need everybody to try and if it's going to succeed, it needs a lot of people to try and give us a push. So just to close, I think we'll want to thank particularly the Global Strategy Lab and as well as the ESMID AMR Action Subcommittee that helped kind of put together a lot of the thought pieces around this. So there's now a call out on the quadripartite website for organizations and individuals who wish, but focusing mostly on organization to try and input that. And so you can input and you can try and what you think should be the sort of science, and so and then feed into that public debate, and ESMID will be doing that as well, and particularly around the wellcome funded Padilla and Gap Year project teams, obviously HITAP teams, and then the Oxford University Professor Ben Cooper and Koen Powles, and then just that last one, thanks Ryan. So ESMID, is a large society, now 14,000 members. It's has a clinical microbiology infectious disease, very much a global reach. And so we've set up the Global Science Policy Forum as if you like, a way in which scientists and policymakers can meet and discuss things without, not in a formal panel, but actually informally, and then try and and then think through some of the questions we've been discussing, today. That and the next one, and this is now annual, and the next one's in April, and we'll be holding this every year. And we're delighted that Sheila's coming to talk to us as well at that panel. So thank you very much indeed for your listening today, and we're happy to have a discussion, and we can think through all of these problems together. Thank you.
Thank you, Mike, for the very insightful presentation. It's great to learn the details for the IPEA. I've actually attended the meeting at Nigeria. At the time, there were a lot of discussions about the governance of IPEA and a lot of different things. So it's good to know that there's structure in it already. So let's go through some of the questions posted in the Q&A box. So we'll go through the earliest question. So what are the plans for operationalizing the IPA? In particular, could you share more in terms of financing and whether there are dedicated funds, although you mentioned none, including for researchers?
Yes, so that's easy, none. That's a straightforward question. So we actually, at the moment, we don't have that. We're waiting for the quadripartite to put out a final document. Hopefully, this will be the final version, and that will be the the final structure. And once the foundation document has been approved by the government, then it can get on with setting up the panel. They had to do that, or were asked to complete that in 2025, and now we're heading into 2026. And so the key then, and then there'll be a launch. There'll be a formal process by which all the panel members will be invited. It's an open call. Anybody can apply, and then they'll select that, and then develop a work plan, and then through that process. So probably, in reality, I don't think it's going to get going until the autumn. I suspect at the earliest. And they obviously everyone's hoping that to be a bit quicker, but around that component. And then, of course, the panel will have to agree its work plan. And then once the work plan's been agreed, then the work will begin. So I expect that will probably take up most of 26, I would imagine, and then hopefully it will get going after that as well. So there isn't, there isn't that much money. So the UK government put in 10 million pound sterling to get the panel off the ground. And that's over a 5-year period. So it's not a huge amount of funding associated with that. Clearly, there's going to be a secretariat. There needs to be a secretariat that's going to be based in Nairobi, and the through the by the sort of kind of UNEA, and then who look after it'll be people who have run other panels as well. So that will I think will sort of kind of will get going after that. But there'll be no call for funding. There'll be no call for any sort of research funds, and there may be a couple of structured sort of kind of calls to do some evidence synthesis on some particular areas, but they will be quite small and very targeted, and often. And so, we don't know the way in which they will be organized at the moment. But on the whole, the expectation is that the great majority of scientists will be giving their time voluntarily to help with this. Thanks.
Thanks, Mike. You've mentioned that the scientists working on the IPA, there should be a good proportion of those from LMICs. How will they make sure that the LMICs are represented in this one?
Yeah. I think that's a critical point, Sheila. So, I mean, the first thing is to really encourage a wide range of, scientists from lower middle income across all the quadripartite sectors to apply, because and to do that, and of course, there's an equity issue there because it is easier for scientists in high income setting who have more robust sort of kind of funding streams, for their work and elsewhere to try and give more of their time sort of kind of voluntarily. Many sort of kind of LMIC, I think that's obviously much more difficult to try and sort of to do that. So I think they won't be paid. And I don't know that for sure, but I would be amazed they don't not pay any of the other panels that I'm aware of. And so, that is hard work, and often there's difficulties with that. So I think the main construct is a big push, a big call out to try and get people to apply, and actively try and get people to apply. And I know the quadripartite will be doing that through their networks, but actually it's also up to us, scientists, to try and to do that as well.
So we have another question related to LMIC. So in terms of representing LMIC perspectives, would you be able to share whether there are efforts to strengthen data sources and quality of data, and what can one learn from previous experiences?
Yeah. As we're saying, I think that's critical. Is the sort of kind of data, and as before, and I think it's important to things is that the it's not that the independent panel's got money to try and improve data at a country level. That's not going to happen. However, I think there is a potential that the panel can try and sort of kind of work through with sort of data synthesis, and with scientific groups to work out, well, what data do you need? What are the key parts of data? What is useful? What policy can you take forward at a country level with what you have, with what we know? And many of that is sort of kind of actually can be done by sort of science. For example, a small example that from the Adila project, we've done, the team, particularly from Oxford, have led a really interesting piece of work to try and say, well, if all you've got is doc import data for antimicrobials at the moment, usually there's not a lot. It doesn't tell you where it's going or what it's going to be used for or who's using it. But what you do have on the invoices, obviously, because it's imported, about whether that's an injection for, and it's a vial for, or whether it's a tablet, and whether it's therefore an oral or an intravenous formulation. And then through a complex modeling that we published sort of kind of soon, actually that's a pretty good proxy for primary care use and hospital use. So actually you can make fairly quick assumptions about whether on the whole this volume of drugs are going to be used in primary care, so therefore you need a primary care focused intervention, or whether it's a hospital and whether you need hospital centered interventions. So I think there are ways in which scientists can be pragmatic, and the panel should who knows? I'm not part of the panel. I'm not on it. Should try and get some sort of fairly pragmatic answers that are actually very relevant to lower middle income settings, that actually use existing data, but also try and inform resource poor countries and surveillance programs, or what to focus on. What actually is the most useful thing here, and that those I think is probably the most useful thing to do.
So another related question. So for LMIC governments, many of the governments, they have limited appetite for addressing AMR. Um, IPEA, can they play a role in mobilizing political support for domestic AMR agenda?
Yeah, and if it doesn't, it's failed. So yeah, so if the outputs are more outputs from another, and then they just sort of sit there as policy briefs that no one ever reads, never ever does. So I think part of that's making it simple. It's too complicated. AMR is so complicated, and it's so hard from a government's perspective, to try and sort of have any, to think about sort of actions, and then also. Governments very reasonably are priority driven. There are many, many problems at the moment and many calls on their time. And this, of course, also is intergovernmental. It's, many different government departments trying to work together, which, as we all know, is complicated. So I think it's about producing sort of simple policy outputs, really sort of, what to do now, what should you do, sort of kind of through that. I think we also have to be realistic. We can look at climate change and other independent panels. It takes time, and I think, there's a bit about, governments and, member states, thinking through that actually this is producing reasonable stuff. It's doing reasonably well. It's producing useful stuff. And then hopefully over time those links, will emerge. That's why I discussed at the beginning, a panel that has just scientists and has no government representation and no government involvement. Mm, and so they need to have scientific independence, but needs to be linked in to governments directly, and so governments do that. There is a biannual ministerial conference on AMR, and the panel would need to make close links to that ministerial conference so that there is a good way in which directly, sort of kind of both formally and informally, then the panel's work can be sort of feed into government strategy.
Okay. So considering that AMR is a global health threat, there are a lot of people that should be working on combating AMR. So these people are coming from different disciplines. So how does one create a common language or agenda considering the four sectors for One Health perspective? So are there any lessons that we can get from the climate change community that can be adapted into the IPEA?
Yeah, so please do put any suggestions, any ideas you have, put them on a post. I'll send. So I mean, difficult, isn't it? And complicated. So and it's interesting watching the climate change and others. I mean, simple goals that everybody can cluster around is really interesting. The 1.5 degree was obviously very strongly discussed, and was actually a simple target, a simple goal that everybody could understand and could sort of kind of could things. Clearly, lots of debate and huge underpinning that. But in the end, public facing, it became something that people could understand and could use, both policymakers, but also the scientists could get behind it and sort of kind of use it as a way to try and sort of foster and gain the energy within that. And and we're heading our way towards that a little bit, within in that as well. But actually, and I think it's now trying to recognize and get a much wider recognize that this is, as I discussed briefly, a biosphere problem. This is no different. AMR is no different from other biosphere agendas. And there's so many examples. This is a natural resource, sort of antibiotics are a natural resource, which humans, smart humans, clever humans, well done humans, have then taken that, identified that, and obviously therefore have in many areas have then led to the sort of use and overuse and underuse and unequal use, and that has led us into sort of antimicrobial resistance and very strong analogies to plastics, to other pollution, to sort of kind of carbon fuels and many other sort of kind of areas. So I think we're now and there is discussion. You've probably seen the literature now on an anti-biocene area. We're in a sort of anti-biocene era, and I think it's starting to use language that is less, clinically focused. I'm a doctor, but actually, now increasingly, you want to try and use language that actually can cross the sectors. Everybody's happy. This is what you're doing, and we need to find language that people can cluster around so that actually reflects the fact that actually everything we do is connected in this area, and then we need to understand how we have language to sort of kind of engage across all of that sector.
So for the next question is kind of political. So given the US administration's withdrawal from WHO and other international or multilateral collaborations, do you foresee any impact on this to IPEA and its future work?
Yeah, and all virtually all our UN agencies are affected by this, as we know, and I think and that's why, and I'm sorry to keep going back to the Independent Panel for Climate Change, but actually, and obviously, the sort of kind of the conference and parties, that is the sort of alongside with that. And this, like obviously, clearly, and many of these organizations, it's tricky. The plastics treaty that was sort of kind of they've been inching sort of forwards around that, and getting consensus across all the different countries has been very difficult. What was quite interesting in the UN General Assembly, I wasn't there. I was standing outside in the rain. But actually, was that actually there was good consensus across the countries, and the 200 countries, agreed that fairly sort of smoothly, sort of kind of through that. And so it's trying to get agreement where you can, and the independent panel is an independent panel. It will produce its outputs and advice. And what's happened in the climate change now is that they've developed a coalition of the willing, so that actually, countries that actually do want to get on with this and recognize that things need to happen, are doing that. And they're just getting on with it and doing that. And obviously, and so I think. We have to recognize that actually, governments and countries change over time, and so who knows what will happen in the future. But actually, in the end, the implementation of this is at a national level. So it's up to each country how they wish to implement or not the outputs associated from the panel. And that will be all sorts of constraints will feed into that, political constraints, but financial constraints, priority constraints as well. So, in some senses, it matters a lot, obviously, hugely, for funding and all sorts of other purposes. In other sense, in the end, the panel will do what it does. It'll synthesize synthesize that, and then it will report back to individual and memberships governments, will then and implement those or not, with all sorts of influences upon those. Thanks.
So next question. How can one better engage with the HTA community in this initiative? So we mentioned cost effectiveness in the presentation
Yeah.
a few times. So given that issues of health economics have also been highlighted in the presentation.
Yeah, and if all the panels in the end, it's the core of the implementation is around cost effectiveness, and that's clearly, we are in very severely challenged health systems globally, with many calls on health systems across the quadripartite sectors and environment and other sectors as well. So all of these need to be derived, and in fact all the language of the independent panel is about, because if you read the zero draft or the other draft, there's a bit of discussion around how much governments are involved, how much the scientists and things. But at the bottom, the sector that nobody disagrees with is this is all about cost effectiveness, and so that's not under dispute. That's not under dispute at all. So I think that's up to organizations and networks of HTA and up to the AMR scientists to engage with those networks, if you like, to try and think through the language, think through the ways in which one can think about how one can try and provide a framework for that. We've got many different interventions here, and so what are the ways in which we can have framework of common language that exist across multiple interventions? How can you compare different interventions? What should you do? If you're a government and you've got a set budget, how much do you give for IPC? How much do you give for vaccines? How much do you give for diagnostics? How much do you give for, how do you give for policy? So how do you try and sort of provide any sort of comparative sort of components to that? Science in that's quite limited yet. And the way in which governments work often is that they'll take a tackle of something that's particularly a critical issue and then do multiple interventions at the same time. And then something goes away, and trying to work out which one worked is also quite difficult. And so in countries that have now put in sort of targets, UK did that. There's data that's showing that actually that affects and improves with a lot of implementation. But then you will put in many different policy interventions and trying to work out what those are, and then what was the most effective and the most cost effective is still quite in its infancy, I think. But I think it's now developing the structures around that. So I think the HTA organizations, that's why we're delighted to be working with HITAP and hopefully HTA Asia, network and in the future of other networks, because actually they're core, I think, to this in the future.
We at Top will be very much looking forward for the future projects regarding AMR. So we're really close to the hour, so I'll hand it over to Titi Panchaya for the summary and closing.
Thank you, Sheila, and thank you everyone for such an engaging discussions and also insightful questions throughout today's sessions. And also thank you, Professor Mike, for very insightful and also thought-provoking presentations. So before we come to the close of this sessions, I would like to briefly reflect on some key points from today's discussions. So as Mike have discussed, well, we explored like the background and also evolving governance of the IPEA and its public health oriented missions and how independent and also multidisciplinary scientific evidence can support like a meaningful actions across AMR and also One Health sector. Also, Mike, you have walked us through like the proposed like scientific work plan of IPEA, like the main three work stream, which is like understanding the trend, driver, and risk of AMR, and also its dynamics, as well as second work stream is on assessing the public health and social impacts of AMR. And the last work stream is about evaluating the cost-effective and context-specific interventions and governance approach. Yeah. And based on today's discussion, there's a strong emphasis on place on equity and also low and middle income perspective, as we also it's also a question, one of the questions raised in the Q&A. And also we also focus on like how science would be translated into like policy relevant and actionable recommendations. And also that how the and to further emphasize like on the how the importance of collaborations across multidisciplinary could help ensure like and to really inform the decisions making to accelerate progress in tackling AMR globally. As Mike mentioned, that IPEA needs you, so we need like the scientists from like low and middle incomes, like policymakers and other multidisciplinary people to help make this happen and to really tackle AMR globally. Yeah, and for so as a PR, that if anyone will be joining the PMAC conference, we are also like holding a site meetings on AMR and aging populations on the 27th. And if anyone wants to further register for this site meetings, you please reach out to Sheila. Next slide, please. So, yep. Thank you everyone for attending this webinar, and also we would like to kindly receive your feedback on this webinar. It will take just a few minutes for you to fill in the response to help us improve the future sessions and make us meet your expectation better in the next webinar.